Good morning. Welcome back to Daybreak on this 8th day of February 2021. My name is Sam Gituku and this is the Daybreak, and we want now to focus on state of COVID-19. And joining us this morning is Dr. Githinji Gitahi from AMREF. And as he joins us, I want us to start by looking at some of the statistics that we know of in as far as the numbers in COVID-19 are concerned. This is the cases as of 6th of February, which was on Saturday. The total tests at that time were 1.2 million. The total infections from that was 101,690. That figure has gone up after yesterday's figures. The recoveries were 83%. The fatalities were at 1.7%. And the active cases were 15.3% or 15,612. And then if you are to look at the weekly infections, we are taking a look at since the 34th week, which was way back in November when the number of COVID-19 was pretty high. Look at that. That we've moved from a weekly total of about 7,700 in the 35th week. That has gone down to a record low of 40 on the 42nd week, which was about 879 infections a week. Then that went down further on the 46th week, which is just the week before last, at 790 infections. Then the week to Saturday, 917 cases had been reported. So you can see what a decline that has been. And if we were to look at the positivity rate, then that would be near a flat curve of between 2 and 4%. Then if you are to look at the monthly infections, that will show you that really the COVID-19 infections in the country are on a decline. Look at that. The highest must have been in the month of November when 28,426 infections were reported. Now that has declined to a low of 4,315 in January. That is the first month of the year, 2021. And then so far 917 as of 6th of February, that is Saturday. That figure has obviously gone up after yesterday's numbers. Let's take a look at something else to do with the numbers and what trends we are seeing. The monthly fatalities has also been declining. The highest must have been in the month of November. Again, 473 people died during that month out of COVID-19. That went down to about 93 in the month of January. That is last month. So you can see how much of an impact, or rather how much of a change the country has registered from a high of 473 to a low of 93. The last time it was that low was in June when 85 deaths were reported. Then this is the latest numbers that were reported yesterday. The deaths were 3. The cases that the new cases that were reported were 129, and therefore giving a total of 101,819. The positivity rate yesterday was 2.7%. The recoveries were 59, and meaning that 84,361 have recovered so far, and those admitted are 391, 37 of them in ICU. But let's listen to what Patrick Amoth, the Director of Health Services at Ministry of Health, spoke about. Patrick Amoth spoke about flattening the curve sometime last week. Listen.
Since the beginning of the year, from 1st of January, the highest positivity rate has been 6.8%, which was on 7th of January, and the lowest was 2.1%. Today's positivity rate is basically about 4.8%, which was the figure again for yesterday. So strictly speaking, you could say that we have actually flattened the curve, but flattening the curve is an event, so it's not very, very important, because for sure we'll still have these surges and spikes going forward until everybody is vaccinated and everybody is offered protection.
All right, Patrick Amoth, the Director General at the Ministry of Health, they are speaking about the flattening the curve. And Dr. Githinji Gitahi, good morning, Dr. and Happy New Year, because I've not seen you this year on this show. But as you begin by looking at what Patrick Amoth is saying, are you as confident that you have flattened the curve in real sense, or is this just a statistical question?
Well, I think as we all say, we've done well, because obviously the rate of infections has come down. If we're to look at two things, the rate of infection, meaning how many people are getting infected every day, and you look at the rate of number of people getting admitted in hospital, those numbers are low, which is a good sign. It's a very good sign. I think what we can predict is what will happen in the next few weeks. We have seen that Kenya now has recorded, some of the new variants from South Africa specifically. I would be very surprised if we don't have any of the UK variants. So we need to watch what that would mean for us before we are too certain that all is well, that the coast is clear.
Right, and you say that obviously the number of infections, the number of admissions have declined, even the severe cases. But when you look at the number of samples being tested now, like on Saturday there were 3,784. I'm comparing that to what was being done in November. It's pretty different, because in November we had even highs of more than 11,000. Does this tell us anything, and what does this mean for our strategy in testing?
So, Sam, remember that testing is, Kenya has not done mass testing. At some point we attempted to do mass testing, and we decided, or the government decided, that's not the right thing to do. So that means that the number of cases being tested are dependent on contacts. So the less the contacts, the less the tests. So the test number may also indicate that we're not having a lot of contacts because the cases are few. If you have only less than 100 cases a day, then you do not have a lot of people to trace to test. That's number one. Therefore, number two is that even if you're testing 1,000 or 2,000 or 3,000, again, dependent on the traced cases, then the positivity rate is a very important statistical number, because if that section of the population that's tested shows that actually the infectivity rate is very low, then you would assume that that reflects the general state of the population. So I would not worry about the numbers being tested. I would watch closely the positivity rate and the reason for the low numbers, which I think is because there are fewer and fewer contacts.
And how do you comment? Because is this the rate of infection low because you're observing the measures? We are just lucky, because if you look at the rate of activities in the country, it has really changed. The political events, the people appear to be dropping the guard in how they behave in public.
I think it's a mix of many things. The first thing is Kenya making a decision to make mask wearing mandatory has been a big contributor to the reduction in infection rates, because obviously we know that the viruses, are in people, and then the people are the ones that transmit them to others through either contact or what we call aerosol transmission through speaking and coughing. And the masks play a big role here. So yes, our response has been effective in controlling the virus. I think the next thing is obviously that we've seen some of the studies by Cambridge showing that we have a big part of our population that may already have come into contact with the virus. If that is so, especially in the very urban areas, Nairobi and Mombasa, it means that these people may have a natural immunity, whether it's short-term or long-term, we don't know. And if a lot of people have that natural immunity, it means that it's more difficult to find somebody within that population. So because you have to think of millions of people, so if you have very many people already with natural immunity, the transmissibility of the virus is reduced. So it could be our effective response, plus also the growing natural immunity that has been seen in people over the last several months.
Natural immunity, but then again, how do you comment to, of course, so far there's a standing guideline that all political gatherings should be stopped, and if people want to do political meetings, they do them in town halls, but they continue on a daily basis, and people had feared that these were going to be super spreader events. What exactly is happening? What is the science behind that?
My view is the sense behind that, number one, is that I want to add my voice that it is reckless to hold open, crowded meetings without observing COVID protocols, because the experts have said it should not be done for now. It's a public health measure. So it's reckless, and I think the government needs to take the necessary measures it needs to take. We shouldn't allow disorder. And as we always say, Kenyans have a big problem with indiscipline, and therefore that is a reflection of indiscipline. Where we have laws, we don't obey them. The same reason we don't obey traffic lights, the same reason why we hold such political rallies without care of the existing protocols. But let me also say that in terms of why have these events not been super spreader events, so we do not know what the impact is going to be as we go along. Because again, if you have a contact event today, you don't see the increased infections tomorrow. There is a lag, and that lag is when the virus is moving. Remember that 93% of our people have no symptoms at all, and therefore you don't know when the people with the high risk start to get the infection. So there could be a lag. That's number one. Number two is that the majority of these people who are attending these rallies are young people. And we have seen that actually, if you look at young people under 19, for example, they contribute less than 10% of our total infection rate. If you go a little upper, maybe to about 30, again, there are not too many. The infections actually start to rise in between 30 to about 49 or so. So it could also be that the people attending the rallies are young people and therefore their transmissibility is low. That is not scientific, that's purely my own opinion, but that is not to say therefore that we should disobey the public health measures.
And of course, details have not been as available when it comes to the situation in schools after reopening. I believe there are more than 50 million learners now are in school starting January 4th. Have you seen any impact of this in the numbers being reported, the trends being reported in different parts of the country?
No, because we had predicted that actually schools will not be big spread events for COVID, because scientifically we've seen that child-child transmission is very low, and those are studies published by other countries that have had a longer learning cycle. So we didn't expect that to be huge. We expected that the school infections will mirror the community infections. So the community infections have come down, then the school infections will be low. Remember that even up to date, even after 15 million learners have gone to school, we still haven't seen the contribution of people under 19 in our total caseload increasing. It still remains 9%, as it was even before, which tells you it kind of maps the community transmission. The only concern that was there before is that people are at risk. Teachers and school staff who have hypertension, diabetes, or are elderly, we may see more hospitalizations from these people because now they're out of their houses. But it seems that actually these people were already exposed through community transmission, and therefore we did not see a spike because of schools. Maybe because of exactly what we are discussing, that even when we had the measures, people continue doing their work and going out. And these are the same people who are teachers and they went to school. So there was no difference, really. We didn't have a total lockdown. So the people already exposed themselves out there. So we haven't seen, I wouldn't say that I've seen personally any spike that is related.
Right. And I had you refer to the Kemri report. That also, there are reports that about 1 in 3 Nairobi residents were infected with COVID-19 between March and October 2020, and Embakasi West, Mathare and Ruaraka were most affected. So it would appear that obviously this virus is affecting more people than those that are able to be found statistically. Does it tell us anything moving forward?
You see, when you're doing testing, it's very difficult to say you're going to test everyone. And actually, it's not a useful exercise to test everyone. That's why mass testing was abandoned, because it's a waste of resources. Because ideally, you want to, if you're looking for a tiger, Sam, you know where to find it. You go to the park or the forest. That's where you find a tiger. But if I tell you go look for a tiger and you're combing the streets of Nairobi, you're likely not to find it. So that's the same way with COVID, that actually if you want to find where the infected cases are, you follow a particular strategy which is likely to lead you to the infected cases, because the purpose of testing is not purely for statistics. It's for pandemic control, so that you find those who are infected and you separate them, isolate them from the community so that you reduce the force of transmission. And therefore, for us, as we move forward, we know that our testing strategy should be maintained by contacts, for example, and also, and that means that as you continue to test contacts, then that gives you an indication of the general infection rate. Remember also that infection in itself is really not a problem if you're not infecting others. The problem is if you're high risk and therefore you're likely to require hospitalization. That's where the problem is. So the two problems: one, if you're infected, can we find you and isolate you so that we stop you from infecting others and therefore reduce the force of transmission? Secondly, if you're infected and you have symptoms, and can we take you to a hospital and can you get adequate treatment so that we save your life? Those are the two things we must focus on.
Right. And Dr. looking at the progress being made, especially the question of flattening the curve, and the disease would appear not to be as severe as it were, Is it time then to review our strategy? I know the few that are standing now is the night curfew, then there's the restrictions in social places, especially when it comes to places of worship, and the social distancing. Well, it has already been abused by the politicians and political gatherings. Is it time we review? And if yes, what are those measures that can be, what is the opposite of tightening? Loosened a little bit.
Well, I think that the measures that we have are bare minimum. You know, the economies have opened, people have gone back to school, offices are opening, and we have seen that, this has helped us to get where we are. Now, we must not then celebrate too early, because remember, as I said, we have a new strain. This new strain may be up to 50% more infectious, so we don't know when it starts to spread. We don't know, if you look at South Africa, 80% or more than 80% of their cases now are actually the new strain. And that's why they had such a big surge, because the new strain is more infectious. So we do not know at what point we get the big impact of the new strain, or if at all. So we can't celebrate too early and say we are done with COVID. We are not. Remember also that there is an effort to vaccinate, meaning that you want to add vaccination to the various layers that we have already been using, which is social distancing, which you say has not been perfect. It has actually been abused. We have wearing of masks, which has significantly improved. I was out in a rural church yesterday, and I was very impressed, very rural church, and everyone was wearing a mask. There were young babies or young kids who were testing temperature at the door, and were also wearing masks. There was a hand washing station, and these have been observed without a policeman. It was actually a basic rural church. So these measures should stay until we can vaccinate everybody, because then we say when we vaccinated everyone, or at least a big chunk of the population, then we can say we have a multi-layered strategy, and we are not likely to get a big surge. But for now, I don't think it's time to celebrate and remove all the measures that we have actually put in place.
Okay, all right. Dr. Githinji Gitahi, stay on the line. We'll be taking a short break, but in return, we'll also be joined by Dr. Chibanzi Mwachonda, who is here with me, the Acting Secretary General of the Kenya Medical Practitioners and Dentists Union, KMPDU. Is that it? Yeah, so he'll be joining us to continue contributing to this question, and specifically on the next phase of battling this pandemic, which is specifically on the vaccination. We'll be trying to see where we are and what priorities should be taken in approaching that. You can text in your views via 22422 or Twitter at Citizen TV Kenya, at Sam Gituku. The hashtag to use is the break.